So hi guys, welcome to Dssg Nation. So if this is your first time watching a video from Dssg Nation, do make sure you subscribe and you hit the bell button so we can notify you whenever we create any video. So today we are going to be talking about hypertension. So pick your paper and your pen and let's get started. Hi guys. So yeah, welcome back. So we said we are going to be talking about hypertension. Hypertension. Now, the word hyper means increased or high level. So, or high level. Why the word tension in medical surgical nursing, I mean in med-surg, it means blood pressure. Blood pressure. So if you say hypertension means increased blood pressure. Now, this hypertension as a disorder is a disorder of the cardiovascular system. So, I know that from our cardiovascular system, the word card is the heart, and the V is the blood vessel, the vascular system. So, which means the blood vessel. So, here we are going to be talking about increased in what? In the pressure of blood within the blood vessels. And that is what we are going to be talking about. Now, we have majorly two types of hypertension. So the major two types of hypertension are the primary hypertension, also called the essential hypertension, and the second one is called the secondary hypertension. So what is primary hypertension and what is secondary hypertension? The primary hypertension is a kind of hypertension that does not have a known cause. So does not have a known cause. Does not have a known cause. So, but for this secondary hypertension, it has a known cause. It has a known cause. So it has a known cause. And that is just different between primary and secondary hypertension. So let's get started with primary hypertension. Before that, let's talk about the stages of hypertension. So yeah, welcome back. We said we are going to be talking about the stages of hypertension. So the stages of hypertension. Stages of hypertension. Now just go and know this. We have majorly two stages, and that is the stage 1 hypertension and the stage 2 hypertension. But let's start with the normal range of hypertension. So let's put the normal here. The normal blood pressure. So let's put the values right here. So this arrow indicates that it's going to be increasing upward. So for the normal, let's put the systolic side here. Systolic side, and then the diastolic side right here. Diastolic side. What do I mean by the systolic and the diastolic? Whenever we are charting our blood pressure in the hospital, we used to use something like 120 all over 80. So we used to use millimeter of mercury. So this upper value is called the systolic blood pressure. Systolic blood pressure. And the lower side is the diastolic blood pressure. Now, what is the meaning of systolic blood pressure and what is the meaning of diastolic blood pressure? The word systole, if you watched our video on cardiovascular system, it means contraction. So the systolic blood pressure is the pressure of the blood in the blood vessels when the ventricle is contracting. So systolic is what? The pressure of the blood. The pressure of the blood, comma, in the blood vessel. In the blood vessel when the what? When the heart, when the ventricle of the heart is contracting. Is contract what? Is contracting. So that contracting means systole. So the word contract, it means systole. So that is the systolic blood pressure. So to the diastolic, it is just on the opposite. The word diastole from our conductive system and the cardiac cycle means to relax. So it is the pressure of the blood in the blood vessel when the heart is relaxing or when the heart is resting. So now, we've known the meaning of the systole and the diastole. The systole is that value on the upper side, and the diastole is the lower value. That is, the systolic is the numerator and the diastolic is the denominator. Now, what is now the normal blood pressure? So we said this side will be for systolic and this side will be for diastolic. So for the systolic side, this upper part, for the normal blood pressure, it should be within 90 to 119 millimeter of mercury. So for the diastolic side, it should be around 60 to like 79. So that should be for the normal, which means 90-60 is still normal, which means 110-70 is still normal, 119-79 is still normal. So for the pre-hypertensive stage, pre-hypertensive, pre means before hypertension really sets in. So the pre-hypertensive phase, let's use pre-hypertension. Pre-hypertension. For pre-hypertension, it is going to be 120 to 139 millimeter of mercury. But for this one, it's going to be 80 to 89 millimeter of mercury. So for the stage 1 hypertension, here it is 140 to about 159 millimeter of mercury. So for the diastolic side, it is supposed to be, this is 89, right? So it's going to be 90 to 99 millimeter of mercury. So for the stage 2 hypertension, stage 2 hypertension. So stage 2 hypertension. So I'm sorry, I think the light is off. So let me quickly on the inverter. I'll be right back. So I'm very sorry about that. So now we said for the normal, we have it from the 90 to 119, and for the diastolic side, 60 to 79. Here 120 to 139, and for the stage 1, 140 to 159. Now the stage 2 for the systolic side is 160 and above. That is 160 millimeter of mercury and above. That is for stage 2 hypertension. And for the diastolic side, it is above 100 millimeter of mercury. So, and those are the stages of what? Of hypertension. So, just to get this thing easily, what you have to put in your head is for the normal, 90 to 119. So after 119, you have 120. So, just like adding like something like 19, 120 to 139. So, then from that 129, it's going to be 140 to 159. Then 160 and above. So same thing for this side. We are going to be using 10 as a difference here. Here is like 19 and here is like 10. So 60 to 79, 80 to 89, 90 to 90, and then above 100 millimeter of mercury. So those are the stages of what? Of hypertension. So let's go to the causes of hypertension next. So now, to the causes of hypertension. We said about the causes, we said the types. We have the primary, and then we have the secondary. The primary and the secondary. So we said the primary, it has no known cause, but instead it has what we call the predisposing factors. Predisposing what? Predisposing factors. What's the meaning of predisposing factors? They are just like risk factors. So those things that you can possess that can make you be prone to hypertension. And what are those predisposing factors? Out of the predisposing factors, we have stress. We have obesity. So 3, emotion. 4 is age. So let me have one more. So let's call it sedentary lifestyle. Sedentary lifestyle. So all these things, they can lead to primary hypertension. So how can it lead to primary hypertension? Now I want you to know this, that whenever you are stressed, there is a release of some hormones called adrenaline and noradrenaline. They are also called epinephrine and norepinephrine. So now they are going to be released to what we call the myoneural junction. So where is the myoneural junction? Myoneural junction is just any junction in the body that is made up of the muscle and the neuron. The muscle and the neuron. So you can also call it the neuromuscular junction. So the muscle and the neuron. And an example of such place that has the myoneural junction is your blood vessel. The blood vessel. So the blood vessel has its own muscles And those muscles are what is responsible for doing what? For increasing and reducing the diameter of the blood vessels. What do I mean? If this is the normal size of the blood vessel, so if it just suddenly turns to be something of this nature, if it constricts like this, and this large lumen now suddenly becomes this, the muscle layer is the one responsible for this. It is responsible for the constriction. If you watch our video on CVS, you are going to get it. But for those of us who have not, I'm going to drop a link up ahead so you can just check it there after this video. So the neuromuscular junction is going to respond to this adrenaline by constricting the blood vessels. And what is the meaning of that? Now, if this is the normal size of the blood vessel, after this adrenaline and noradrenaline, after they act on it, it's going to turn out to be like this. So which means the diameter has what? Has reduced. And now in our school physics, we learned that from, I think that is the Boyle's law. So they showed us a chart, something of this nature. So you have your V here and you have your P here. So another V, another P, so another V and another P. And what is the meaning of this? It means as the pressure increases, the volume is going to decrease. And as the pressure decreases, the volume is going to decrease. So this is just like your balloon, an inflated balloon. So after inflating, it is going to be big. So which means the volume is high. But when you try to put pressure, when you try to apply pressure on it, what's going to happen? The volume is going to decrease back. So which means the volume has decreased. Why? Because you exert pressure on it, you increase your pressure. Now imagine the volume of blood here is really high, which means the pressure is going to drop right here. But now vasoconstriction has occurred due to the effect of these hormones. So it turns out to be what? To be reduced. So the volume has reduced here, which means the pressure is going to increase. And if there is increase in the blood pressure, that will cause what? Hypertension. And that is how stress can lead to what? Can lead to hypertension. During stress, there is release of adrenaline and noradrenaline. And these, they are going to be released at the myoneural junction. And the blood vessel is a kind of vessel that has that kind of junction. So it is going to bring about the constriction of the blood vessel, hereby reducing the volume and shifting up the pressure, hereby leading to hypertension. And that is how stress can lead to what? Can lead to hypertension. So let's pick the next one, obesity. But let me just explain it before we do that. So in obesity is just increase in weight. So there is excessive increase in weight. So but most of the time it's due to the deposition of fat within the body. So we have different fat stores in the body, different fat stores. So for male, they can have their fat store at the back of the neck, you can have their fat store in their arm, the thighs, the belly, the abdomen rather. So the abdomen. So they can accumulate fat around there. So for the female, they can also accumulate fat around all this place. But they can't. But the back of the neck is not that really prominent. I mean, it's not that really common. So they accumulate theirs at the thighs, the buttocks, the breast, and some other waist, and some other stores. So when all these stores are exceeded, what is going to happen? The next thing that is going to happen is that the fats that are being stored, after they filled all these stores, they are going to shift into the blood vessel. So the fat cells, they are going to come into the blood vessels. So they are going to accumulate into the blood vessels. So in between the space of the tunica adventitia, the tunica media and the tunica intima. So if you watch our CVS, you are going to understand this better. So if you have not, once again, just make sure you go there and go and do that now. So this is going to lead to what? This is going to lead to reduction in the volume of the blood vessel. So there will be increased peripheral resistance here. So as the blood is trying to pass, it is going to encountering some kind of resistance. Resistance means like a form of obstruction or something that is preventing progression. So resistance is going to be there. So I'm just doing like this and my hand is going into the air. So let's say something is right here So that thing will be putting up a resistance. It won't allow my hand to move against this place again, this place anymore rather. So like that increase in resistance is going to shoot up the blood pressure. It's going to shoot up the blood pressure because the left ventricle of the heart, we see a reason to increase the pumping activity against all this, and that is going to cause what? It is going to cause high blood pressure as well. So we talked about emotion. So emotion, it uses the same physiology as stress. So during emotion, there's going to be secretion of adrenaline. So secretion of adrenaline and noradrenaline. And we said they are both vasoconstrictors. Vasoconstrictors. So since they are vasoconstrictors, they are going to be released at the neuromuscular junction of the blood vessels, and that is going to bring about constriction of the blood vessel. And so far there is a reduction in the volume, there is going to be an increase in the pressure according to Best law. And that is how it can also lead to increased blood pressure. So lastly, we talked about the age. The age. So with age, the blood vessels, they are going to become sclerotic. Sclerotic is from the word sclerosis. And sclerosis means hardening, something to harden up. So and when the blood vessels are hardened, they are going to become narrowed. So they are going to become narrowed, and that will do what? That will decrease the volume. And after decreasing the volume, it's going to do what? It's going to shoot up the pressure. So and that is how age can also lead to what? Can also lead to hypertension. So let's talk about the causes of secondary hypertension. Now, for secondary hypertension, so things that can lead to secondary hypertension are just things that can cause reduction in blood supply to the kidney. Reduction in blood supply to the kidney. Reduction in blood supply to the kidney. So, example of those causes are thromboembolism. So another thing is arteriosclerosis. So another thing is atherosclerosis. So another thing is okay, I talked about a sedentary lifestyle the other time. So about sedentary lifestyle under primary hypertension, sedentary lifestyle is just that kind of lifestyle where you are not really exercising your body. So anything you want to do, they are getting it done for you. So it's just like those women at Gbagi Market. I'm very sorry to say that. So those women at Gbagi Market, so they just asked their help to do everything, and they just put their legs on the stool and food will be in front of them. Some even take alcohol. So that is an example of sedentary lifestyle. So just sitting in one place, not really exercising your body. So just eating, drinking, and asking people to do everything for you. So that's the sedentary lifestyle. And what is that going to lead to? That is going to lead to accumulation of fat, and the fat is going to run where? Into the blood vessels, and it's going to cause what? It's going to cause an increase with peripheral resistance, thereby leading to blood pressure. So now back to what we're talking about: the thromboembolism, the atherosclerosis, the arteriosclerosis on its own. So after then, we still have a lot of things such as heart failure. Heart failure itself can cause hypertension, but I won't like to put that because it is after hypertension that we set in heart failure. So let me quickly explain all these three causes. How can they lead to hypertension? Be right back. So now, what is happening in thromboembolism? Now, let's say this is the blood vessel. So if there is a damage to the blood vessel, the platelets, they are going to run to the site to promote healing of that side. So the word thrombo is from the word thrombocyte. And these thrombocytes, they are what? They are the platelets. So the platelets are going to run to the site of injury just to heal it up. Now, what's going to happen? The blood coming like this, coming this way, they are going to be meeting up with a resistance. And now look at it. The blood is supposed to pass through a full length of the blood vessel like this. But now, the blood will have to be reduced. And the pressure here will be very high. So, and then it is not going to supply the organ here very well anymore. So, and that is not where we are going to. Now, all this resistance that it puts up, the cardiac activity, the heart, the left ventricle to be precise, is going to increase the pumping activity. It's going to do what? It's going to improve and increase the pumping activity, because the blood needs more pressure to pass through this place. So while pumping it, the pumping activity of the blood can cut off. It can cut off a whole bunch of these thrombus that have been formed. So, and then these thrombus now, they are going to move further. And then we know that from our cardiovascular system, they actually will always branch to form what smaller branchings called arterial. Now imagine that this keeps on rolling. When it reaches here, it is going to obstruct the artery, the artery rather completely. So same thing can happen to any of these sides, and this is going to do what? It's going to reduce the blood supply to the organ they are supplying. So now this is going to increase the pressure within the blood volume, because there within the blood vessel rather, because there has been a what increased peripheral resistance, and that is how thromboembolism can lead to what? Can lead to hypertension. So let's talk about the second one. Or let's not waste our time. Let's say all these ones, they are fats as well. So that if it's fat now, instead of thrombus here now, instead of the thrombocytes to come and be accumulated here, it is going to be the fats. So when the fats, when they accumulate within the blood vessel, they are going to cause something we call atheroma. So atheromatous plaque. So the atheromatous plaque, so it's going to be the one that will form the atherosclerosis. And the movement of blood against this is going to increase the peripheral resistance, which means the heart is going to need more energy to push through, and that is in what? Increase the pressure of the blood against the peripheral resistance. And that is how it can also lead to what? To hypertension. So in arteriosclerosis, arteriosclerosis. So what used to happen in arteriosclerosis? This is arterial, right? So in arteriosclerosis, the artery, what's going to happen to the artery? The arterial denotes the word arterios. So what's going to happen to it? So if this is the artery, it is going to become sclerosed. It's going to become hardening. So, and that hardening is going to narrow it. So which means the volume will be what? Will drop. Which means the pressure will do what? The pressure will shoot up. And that is how it can lead to what? To hypertension. So let's move to the pathophysiology of hypertension proper. So let's talk about the pathophysiology of hypertension. Pathophysiology of hypertension. On the norms, I should be talking about the essential hypertension separately. Like I should talk about the pathophysiology of primary hypertension separately, and then the secondary hypertension separately as well. But I'm just going to be running it through together, and I'm going to just show the demarcation where the primary hypertension stops and then where the secondary hypertension sets in. Now, from our courses, we said what really happens majorly is increase in peripheral resistance. So like if this is a blood vessel now, let's say this is a blood vessel supplying the heart, which means this is a branch of the coronary artery. Coronary artery. So it's going to give branch into arterial. Now let's say one of our causes for hypertension, such as thromboembolism, so or atherosclerosis. So it has increased the peripheral resistance, or the thrombus has occluded one of the one of these arteries. So that is going to increase the peripheral resistance. But first, it is going to reduce the amount of blood supply to the heart. Let's say this is the heart now. These vessels are supplying the heart. So it means it is going to reduce the amount of oxygen to the what? To the heart. And from our ingina pectoris, what will happen? Anaerobic beating will set in, and that is going to lead to the production of lactic acid. Production of lactic acid. And that is going to bring the sign and symptom, which is chest pain. So, chest pain that is radiating to the jaw, the arm, the neck, the back. So all this can be the sign and symptoms. Now, after that, the heart will try to do what? The heart will try to compensate for the body needs, because the body will need a lot of blood supply. But the heart is going to increase its activity, and that can lead to what we call tachycardia. Tachycardia. So initially there will be tachycardia. The word tachy means fast, and the word cardia is denoting the beating of the heart. So there will be fast beating of the heart, increased activity of the heart, because the heart will want to meet the body needs. Because in hypertension, we said most of the times constriction used to occur, and constriction is going to decrease the blood volume. So which means the glands or the organs are not going to be able to receive adequate blood supply. So the action of the heart is going to increase. So, and that is one. Now what happens next? Since there is constriction of these blood vessels, and we said our blood vessels, they are not just like this pipe. So there is some kind of convoluted vessels throughout the body, so which contains series of capillaries. Now imagine that the pressure is really high in this place, so it can bruise this blood vessel and can cause a tear. So there can be a what? There can be a tear in the innermost lining of the blood vessels. There can be a crack. So there can be cracks due to the increase in pressure, and these cracks is going to lead to what? Is going to lead to accumulation of thrombocytes into that very region, and then increase in blood supply can still break this thrombus to form thromboembolism and further occlude the blood vessel. I mean the arterioles in the distal part of that blood vessel. And then let's imagine that this rupturing of this artery now, it occurs to the cerebral arteries, one of the cerebral arteries. So the artery supplying the brain. This means there can be headache. So rupturing of the what? Rupturing of one of the cerebral arteries can lead to headache, which is another sign and symptom. So if the rupturing occurs to the retinal artery is the artery supplying the eye. So it's one of the arteries that's supplying the eye, and there are tiny arteries. So increase in pressure of the blood can also rupture it, and when it becomes ruptured, it can lead to blood vision, which can later cause blindness. So let me clean the board and then proceed. So what will happen after this tachycardia? The heart is going to become flabby. It is going to become enlarged. So something we set in that we call cardiomegaly. Cardiomegaly, which means the heart is going to be enlarged. The word megaly means enlargement. So because the heart has been subjected to tachycardia, so the heart is going to exercise itself until it becomes flabby. So cardiomegaly is going to set in. Now what will happen next? Let me just clean the board and then we'll go into that. So I said in the pathophysiology, there will be increase in blood supply, in blood pressure rather, and it can bruise the what? The innermost lining of the blood vessel, leading to wound, and it can also lead to rupturing of the what? Rupturing of that very vessel. So I said if it happens to the cerebral arteries, it can lead to headache, which is a sign and symptom. And then I said if it happens to the retinal artery of the eye, it can cause blood vision, and with time it can result into what? Into blindness. So, and after that, what's going to happen next? We said the heart is going to do what? The heart is going to increase its activity to meet the body needs. So after tachycardia, it's going to increase activity, fast beating, which is called tachycardia. After then, the heart is going to become weak and flabby. It is going to be enlarged, and that is going to cause what we call cardiomegaly. So what is going to happen next when the heart is now tired of beating? There will be congestion of blood. Blood now coming from the lungs. Blood coming from the lungs that enters through the pulmonary artery. So, pulmonary vein rather. So, blood is going to come back into what? Into the ventricle. But now the ventricle is not able to pump it through the aortic valve into the aorta again. So, what will happen? That blood is going to be regurgitated. So, it is going to regurgitate. That is backflow. So, it is going to go back into the what? Into the pulmonary veins. And now your pulmonary vein is coming from the where? The pulmonary vein is coming from the lungs. So, from the lungs. So the blood is going to go back into the lungs, and when it reaches the lung, it's going to cause what we call pulmonary congestion. So pulmonary congestion is also another sign and symptom for hypertension, pulmonary congestion. So you can also use pulmonary edema, because the time edema is going to set in within the lungs. And now what is that going to cause? Just imagine someone is having pulmonary edema. So there will be no exchange of gases very well again. The exchange of gases is going to be impaired. So, and the person can also have chest pain. Okay, we've talked about that while talking about the lactic acid. So let's strike it out. So from pulmonary congestion, another thing that can happen is dyspnea, difficulty in breathing. So dyspnea can set in. So after that, now the blood within the lungs, where is it coming from? Okay, the lung, the blood inside the lungs. How does blood reaches the lung? That is from what? Our pulmonary artery. Our pulmonary artery. So pulmonary artery is supplying the two lungs. So the blood from the two lungs, since regurgitation has occurred and the blood has went back into the what? Into the lungs. So the lung also is going to release the blood again because the heart is not pumping very well again. Bradycardia has set in. So the blood is going to come back into the what? It's going to come back now into the what? Into the right ventricle. And from there the blood is going to regurgitate into the what? Into the right atrium. And from there it is going to go into what? The superior and the inferior vena cava. The blood is going to go back into the superior and inferior vena cava. And that is going to lead to what? It is going to lead to what we call anasarca. And anasarca is what? Generalized edema. Anasarca. It means generalized edema. So there will be edema of different body parts. So at the peritoneum, you can call it ascites. So ascites is also a sign and symptom of what? Of hypertension. So there will be distended neck veins. So, and a lot of edema, cerebral edema, the pedal edema. Now what is going to happen next? Everything we've just talked about right now is just under the essential hypertension. So the next thing that will happen next, that is where the secondary hypertension will be setting. So let me quickly give a recap. When there is hypertension, the blood vessels are going to be cracked and it can lead to rupturing of blood vessels. So rupturing of the blood vessels supplying the cerebrum of the brain can lead to headache. So rupturing of the retinal artery can cause blindness. And then reduced oxygen supply to the heart itself will make the heart to do what? To use anaerobic mode, and that is going to lead to the production of lactic acid. And what will happen then? The heart is going to undergo tachycardia, which means fast beating, to make the body names. Because we said in hypertension, the blood vessels are always constricted, and you can't compare the volume of blood within a constricted vessel to that of the normal size or a dilated vessel. So that reduction in blood supply is going to affect the myocardium itself. And then with time, the myocardium, after a series of beating, it is going to become weak and flabby, and that will lead to cardiomegaly. And after then, the heart will not be able to pump blood effectively again, which means the left ventricle that is supposed to pump blood into the systemic circulation, that is into the aorta like this, will not be able to do that again. You're not able to do it. You're not able to pump the blood into the systemic circulation again. So on the other hand, regurgitation will occur. The blood will start flowing back into the lungs, and from the lung into the pulmonary artery, then back into where it's coming from, which is the right ventricle. And then regurgitation of the blood will go into the what? Right atrium. And then how does blood reaches the right atrium? That is through the superior and inferior vena cava. So the blood is going to be going to the upper part and lower part of the body again, instead of going into the heart. And that will lead to generalized edema called anasarca. And the accumulation of the fluid into the peritoneum is called ascites. So the person will have a big stomach. Well, in reality, it is not because of food or pregnancy, that is conception, but it is due to the accumulation of fluid into the peritoneum. So the person can have pedal edema and the likes too. Now, what is going to happen next? That is secondary hypertension. So I'm going to come in with it right now. Stay tuned. So now, what about the secondary hypertension? When I was talking about the causes of hypertension, I said for the secondary, it is anything that can lead to reduced renal flow. I mean reduced blood supply to the kidney. Now, what will happen after flabbiness and cardiomegaly? So enlargement of the heart. So there will be reduced in the pressure of blood, since the left ventricle cannot pump the blood effectively into the blood vessels again. So what's going to happen? So the pressure at which the blood will be moving will not be really high anymore. So what's going to happen? That reduced pressure, that blood with reduced pressure is going to flow to the what? To the kidney. And what will happen? That will trigger a mechanism that we call RAS. So low blood supply to the what? Low blood supply to the kidney is going to lead to the secretion of renin. And now that renin will act on another enzyme called angiotensinogen. So that angiotensinogen comes from the liver. It comes from the liver. So if you know nothing about the RAS, you can just go and read about it. But you can wait for us in the next 4 or 5 videos. We'll be talking about the RAS. So now renin is going to do what? It's going to convert angiotensinogen into angiotensin 1. And now what's going to happen? There is an enzyme again that's going to be produced, and that enzyme is called ACE. ACE means angiotensin converting enzyme. Angiotensin converting enzyme. That is an enzyme that does what? That converts angiotensin 1. So that ACE is now going to act. Is going to act with what? With angiotensin 1 and it's going to convert it into angiotensin 2. Angio what? Angiotensin 2. And that angiotensin 2 is a potent vasoconstrictor. A potent what? A potent vasoconstrictor. And now being a vasoconstrictor is going to act on the what? On the blood vessels that are what? That has reduced blood pressure. So it's going to constrict them. It's going to do what? It's going to narrow them. And now the volume has decreased, which means the pressure is going to shoot up again. And now what was the problem that we're talking about? So the problem we've been talking about is hypertension, which is high blood pressure. So reduced blood supply to the kidney is going to lead to increased blood pressure again. And this increased blood pressure is going to be complicating the whole issue. And that is going to lead to what we call the complication of hypertension. So what's going to happen next? Increased pressure will lead to damage of different organs in the body because they are going to overwork themselves and they are going to become tired. So such organ is the heart itself. So the heart can undergo arrest, which means one of the complications is cardiac arrest. Cardiac arrest. So before then, there will be congestive cardiac failure as well. Congestive cardiac failure. That was what I was talking about in the essential pathophysiology. Pathophysiology of essential hypertension, rather. That the regurgitation of blood is going to be occurring. So all those things are what? They are what? They are the complications of hypertension. So a quick recap on this. For the secondary hypertension, the reduced blood pressure to the kidney is going to trigger the production of renin. And renin is going to act on an enzyme called angiotensinogen, which is produced by the liver. And then it is going to form angiotensin 1. So the reaction between the renin and the angiotensinogen is going to produce angiotensin 1. And angiotensin 1 is going to be converted into angiotensin 2 by this ACE, which comes from the lungs. And then that angiotensin 2 is a vasoconstrictor and it's going to worsen the whole situation. And that is how the pathophysiology trend of the disorder is going to keep on going till it's set in the complication. And that is that on what? On the pathophysiology. So that is the end of our video for today. So we are going to be talking about the nursing management and the nursing care plan for hypertension in some other videos. So if this is your first time watching a video from the Dssg Nation, just do make sure to subscribe and hit the bell button so we can notify you whenever we create a video. Hi guys.